let's talk psychopathy. So first, let's start by defining what we mean by a psychopath. So Hare describes a psychopath as a social predator who charms, manipulates, and ruthlessly plows their way through life. Okay, they're going to lead a trail of broken hearts, financial ruin, criminal victims, shattered experiences, empty wallets behind them. Now, the key thing that distinguishes a psychopath from non-psychopaths is going to be their lack of empathy, okay? They generally don't have a conscience. Now, think about how your behavior would be different if there wasn't some little voice inside of you trying to guide your behavior in a moral way, okay? They tend to violate social norms and expectations, no sense of guilt, no sense of regret, okay? And we're going to talk about psychopathy in a very cursory surface manner for our purposes. We do have a whole course here that we've taught on psychopathy that gets into it in a little bit more depth, okay? Now, some people will break psychopathy down into primary, secondary, and disocial, okay? These are not necessarily helpful, and I don't know how much I buy into primary versus secondary. Generally, the difference between them is that your primary psychopath is what you think of as a psychopath. When you think of a guy like Ted Bundy, it's that kind of psychopath, whereas the secondary psychopath is sometimes called a successful psychopath. So those are people who are psychopaths, but they're not like carving people up, okay? They're not violent. They are super destructive. And disocial psychopaths display aggressive, antisocial behavior they learn from their subculture. Now, you're not going to go see your therapist and they're going to diagnose you as a psychopath. Psychopathy is a diagnosis that gets used in hospitals for people who are criminally mentally ill. And so those specific kinds of hospitals, like you're not going to go to Mass Gen and get diagnosed with this. And penal institutions, prison. And that's actually who most of the research on psychopathy was done on inmates. What you might be diagnosed with, though, which is in the DSM, and your psychiatrist, your psychologist, your therapist could diagnose you with, is antisocial personality disorder. So a psychopath is kind of like a specific subset of antisocial personality. Antisocial personality is a pervasive pattern of disregard for and violation of the rights of others that's been occurring since the age of 15. Okay? Now, we don't diagnose minors, anyone under 18, as either a psychopath or having antisocial personality disorder. They often get diagnosed with what's called conduct disorder. Okay? And in order to be diagnosed with antisocial personality disorder, you have to meet 3 or more of the criteria, which are listed out in the DSM, and they include repetitive lying, impulsiveness, disregard for the safety of others. Okay? Now, you have to have had these symptoms earlier, but you have to be 18 to be diagnosed with this. Okay, so generally, a diagnosis of conduct disorder does not always lead to psychopathy or a diagnosis of antisocial personality disorder, but anybody diagnosed with either of those should show evidence of conduct disorder prior to age 15. Conduct disorder, by the way, sounds very similar in definition to antisocial personality disorder. And I don't think I put it in here, but that's definitely a thing that we could Google quickly and look up. So as I mentioned, psychopathy always involves criminal behavior, okay, whereas antisocial personality does not. And as I said, antisocial personality disorder is an actual diagnosis in the DSM. Now, there's a couple different people that are really prominent in this field and like the study of psychopathy. There's Cleckley and there's Hare. Okay, and Hare has a PCL checklist. So that's the psychopathy checklist. That's what PCL stands for. There's currently a revised one, PCL-R. Okay, and Cleckley has like a definition of a primary psychopath. Okay, now there's been some fine-tuning, refinement of this since then. Hare's is often broken down into 2 categories. Those 2 categories have then also been broken down into 2 smaller categories within each of those. Again, that kind of goes beyond the scope of what we're going to talk about, but we do have a course where we spent a lot of time on this. So the psychopathy checklist is glibness and superficial charm, a grandiose sense of self-worth, pathological lying, cunning and manipulation, a lack of remorse or guilt. That's kind of the hallmark there. Shallow affect. So they might say all the right things, say all the right feeling words, but it's kind of like the lights are on and no one's home. Callous lack of empathy, which we've talked about in some prior chapters. Failure to accept responsibility for their actions. You might also see promiscuous sexual behavior. Generally, there's a lack of realistic long-term goals. And guys, there's some like really interesting research articles out there where they'll describe people and what their so-called long-term goals are. Poor behavioral goals, high need for stimulation, easily bored, and irresponsible. Okay. Now, Cleckley's is pretty similar, right? We also see superficial charm, pathological egocentricity, lying, manipulation, lack of remorse or guilt, poverty of effective reactions. That's that shallow affect, shallow feelings. Not very responsive in interpersonal relationships, not reliable, impersonal sex life, doesn't follow a life plan, impulsive, inadequately motivated antisocial behavior, poor judgment, no delusions, no anxiety, and then some bizarre behavior after drinking alcohol are also on Cleckley's list. So they're similar. Hare's is the checklist that gets used. You can Google it. There's some online ones where you can check off your own answers and see if you qualify as a psychopath. So behaviorally speaking, psychopathy consists of superficial charm, average to above average intelligence. That's a little bit of a misnomer, sort of like everyone will tell you how serial killers are super smart, and that's not really true. They often seem friendly and outgoing, right? So they seem charming. They might be pretty likable to people, especially people who don't know them very well. And they're verbally skillful, okay? They've got a lot of like stock phrases. They repeat the same ideas. They use abstract terms and jargon. They don't know how to use it correctly. They make a lot of inconsistent statements. And when you call them out on it, like if I caught you guys in a lie, right, telling me one thing and then telling me something else, most of you would probably feel your heart race a little bit. You'd get nervous. You'd feel guilty about like telling a lie, nervous about getting caught and getting in trouble. They don't have this kind of reaction. So as I said, there's some evidence that they score higher on intelligence tests. They often don't have severe mental disorders, okay? And there's a lot of debate here about like, well, isn't a psychopath mentally ill? Is a psychopath insane? They're absolutely not insane. They do know the difference between right and wrong. They don't care. Some who find themselves in desperate situations may die by suicide, especially if they're impulsive and violent. But it's not about an underlying mental health disorder. It's about like you're about to be caught and face consequences, and it's a way out of an intolerable situation. Whether that's like you've been surrounded by the police or you're facing a very long prison term. Some other traits we see in psychopaths: selfishness, generally an inability to love or gain affection. They're egocentric. As we talked about, they have that flat affect. They don't generally like keep in touch with family. They don't care about telling you the truth. They're seeking a lot of stimulation, right? So there's some theories that perhaps they're under aroused, and that's why they're engaging in like thrilling or high risk behavior in order to like stimulate themselves. Now, not every psychopath is a criminal, and not every criminal is a psychopath, although there is a high percentage of psychopaths that are incarcerated. So a criminal psychopath engages in a wide range of behavior. Very serious antisocial behavior, pretty persistent. They tend to be dominant and manipulative. Okay, they are impulsive. I don't mean impulsive like you're standing in the checkout at Marshall's or TJ Maxx or Target, and the brightly colored, fun, shiny objects at the checkout caught your eye and you bought them. Like, these are people who are like having a thought and they're acting on it immediately. Sometimes even before the thought is fully formed. Engage in a lot of risky behavior, antisocial lifestyle, okay? Now, that PCLR is a range of, I think it's 22 questions. They're rated on a scale of 0, 1, or 2. Okay, 0 is not present at all. 1 is present sometimes. 2 is like, whoa, that totes describes you. And then it's added up, and a score of 30 or more constitutes psychopathy, a diagnosis of psychopathy. However, it exists upon a continuum, okay? And just because you scored a 29 doesn't mean like, whew, no problems. Like, if you scored a 29, you're probably a pretty big problem. Okay. It's about 1% of the general population, but in prison, it's about 15 to 25% of the prison population. Now, that just kind of makes sense, right? If people don't have any, like, regard for following the rules, they suck at long-term planning, they have no conscience, right? Then those are people who are probably breaking the law more often. Most violent, persistent offenders probably meet the definition of psychopathy, and they have very high rates of recidivism. In fact, there's nothing you can do for them clinically. There's no medication that stops them from being psychopaths. There's no amount of talk therapy that works. In fact, therapy makes them better psychopaths. Think about it. In therapy, you're learning, right, about empathy and how did you feel and how do you think that made your partner feel, right? This is not, like, psychopaths can understand this intellectually, but they can't actually, like, feel it and experience it. Now, psychopathic sex offenders, obviously, troubling combination, right? They're motivated by thrill-seeking and excitement. They're more sadistic than violent. And they're going to more likely to engage in sexual homicide and severe forms of that. Psychopathic serial killers, and while there are a higher representation of psychopaths amongst serial killers, probably most serial killers are not psychopaths. These guys, though, are going to be sort of your textbook definition of what you think of when you think of a serial killer, okay? So if you think about a guy like Brian Kohlberger, right, who was recently pled guilty to the murders of those college students in Idaho, that's pretty sadistic and brutal. You think about a Ted Bundy, right? So they're deriving pleasure from the sexual suffering of others, the fact that the sexual contact is non-consensual. They're more likely to attack a stranger, and they're often callous and cold-blooded. So as I mentioned, we often measure this using the PCLR. There's a couple other tools, but the PCLR is the most widely known one. You can easily find that checklist on the internet. It's assessing affective, interpersonal, behavioral, and social deviance. Okay? Now, this is tested on a certain type of population. So, institutionalized, incarcerated, generally men. Okay? It's the best predictor for North American white males because that's who it was developed on and that's who it's been tested on. Okay? So the cutoff in Europe is actually 25, not 30, because culturally behavior is different, right? And we don't know how closely or accurately this describes female psychopaths because it wasn't designed or tested for them. Okay? It's designed to identify psychopaths in male prison, forensic, psychiatric populations. Okay? If you score below 21, you're not a psychopath. Okay? It is a powerful predictor, though, of violent recidivism. Because if you get off on hurting other people and you don't feel guilty about that, what is to stop you from your bad behavior? Right? Like, what stops you from your bad behavior today? Sure, we don't want to get in trouble, right? And we don't want to go to jail. But that's generally not the thing that's actually stopping us, right? We care what other people think about us. We care about other consequences of our behavior. None of us want to go to prison, for sure. But we're also thinking about everything else we would jeopardize. Now, some of the criticisms of the PCLR is that it's been confused with the concept of psychopathy itself. So is the criminal behavior a core feature? And so therefore, like, if so much of it has been developed around criminals, then it's probably not going to be good at detecting people who are not criminals. The other thing that's going to be hard about finding those people is, though, these are not people who are going to seek out therapy. So how are we going to learn about the ones that aren't criminals, that don't come to the attention of the authorities? It's going to be harder to learn about them, right? They're going to have some motivation for wanting to talk about themselves. And we're going to have to hope they're honest about it when we know a key feature is that they're manipulative and liars. So as I mentioned, it's kind of broken down into 2 factors, right? And then there's actually 4 factors. So it was originally 2. Today there's 4. Okay. So factor 1 has to do with impersonal and emotional components, being remorseless, callous, selfish, not benefiting from treatment. That's not a word. Factor 2 is socially deviant, antisocial lifestyle. So that's like your behavior, poor planning, impulsiveness, prone to boredom, spontaneous, impulsive violence. These things, so like that first factor is really related to your genetics and your biology. The second one is believed to be related to your socioeconomic status, your education, cultural background. Okay. Factor 3 is emotional shallowness, callousness, and lack of empathy. So as I mentioned, right, originally there's a 2-factor and then there's a 4-factor one, right? Some people refer to this 3-1, but I haven't seen that referred to very much, right? That 3rd factor is going to be affective, that shallow affect, lack of remorse. And the 4th factor is antisocial tendencies. And you can see here, our book has like a nice little chart that's kind of helps us look at that. Now, some people are like, what should really be a factor here is boldness, okay? This is an interpersonal style characterized by being fearless, okay? Relatively immune to stress or anxiety, and being successful at negotiating social interactions to achieve your desired goals, okay? Think about this. There's a lot of psychopaths in the business world, okay? They go undiagnosed because, again, the kind of behavior they're engaging in is really crappy behavior and probably white-collar criminal behavior, but that generally isn't coming to the attention of the authorities, right? You would need someone to see that this white-collar crime's happening to begin with. And so we see a higher percentage of this, and there's some research, about like white-collar corporate psychopaths. They have an ability to remain calm and focused in high pressure, life-threatening situations. They demonstrate high self-assurance, right? They can recover quickly from stressful events. They seek out things that are unfamiliar and dangerous. It's also a meanness factor, right? If you think about some of the characteristics, being deficient in empathy, not having empathy for others, disdain and lack of close attachment with others, rebelliousness, seeking exploitative and empowerment through cruelty, extreme arrogance, defiance of authority, physical cruelty towards people and animals. By the way, physical cruelty towards animals is always a concerning behavior. If you see that in somebody that you know, there's some research referred to as the McDonald triad, and some research says it exists and some says it doesn't. Either way, if you have these traits, they're worrisome. They are correlated with violent behavior. One of them is cruelty towards animals. The other one is bedwetting. Not bedwetting like you're 3 and you're learning how to, use the toilet. Bedwetting beyond an appropriate age, and that can't be linked to a biological issue. Okay, I don't know how predictive that is. But the other one that is also concerning is fire setting. Okay, so people who are setting fires, people who are cruel to animals, if you see this in a young person, like that's a person that really needs a referral. I mean, if you see it in an adult too, but with a young person, that person really needs a referral to some psychiatric services. Okay, these are people who are seeking pleasure and satisfaction, and they don't care who gets hurt in the process. As I mentioned, we know a little less about female psychopaths that are not as studied. Okay, they're less prevalent than males. They're probably about 15% of jail inmates, right? But amongst men, it's higher. It's 25. Wow. Guys, 20-2005. That's probably supposed to be 20 to 25%. Other studies have found it's about 13%. Some find it's 9%. They tend to have lower scores on the PCLR. Okay. Now, That might be that they have different behavioral patterns. It could be that female psychopaths are different. Just like we have learned more recently that like ADHD presents differently in women than it does in men, which led to a lot of women not being diagnosed and a lot of women being diagnosed now in their 30s, because it looks different. In women, we don't see like a lot of the hyperactivity associated with ADHD. That's more typical in boys. And so we see some different patterns here. We still see, though, that lack of realistic long-term goals. We see a lot of relationships, a wide range of crime, but women are a little more subtle and skillful in their aggression. Their harmful acts might not be noticed by authority figures. They're going to have experienced more sexual and physical victimization. They tend to start their bad behavior later than men, and they don't recidivate as much as men. Now, as I mentioned, we don't label juveniles as psychopaths, okay? And mostly because it's not very nice. And labels stick, right? And when we label someone when they're still a very young person, it can be very hard to shake that label. And then there's a whole theory that called labeling theory that basically if someone adopts that identity, then that shapes their future behavior, okay? It's especially damaging for minors because the prognosis for this is poor. We don't cure psychopathy, okay? People don't get better, right? We don't have anything that works. Now, juveniles might be like being assessed for this, though, especially if they're in the juvenile justice system, and they're probably going to be assessed for conduct disorder, right? But so much of us biologically, socially is changing during those years that it's hard to know what is normal adolescent development and what is like, I should be really worried about this kid. Some of the same behavior that is present in psychopathy could also be like behavior of someone reacting to physical or sexual abuse. And remember that the younger you are, right, you don't have as much control over your emotions. You have poor judgment, right? You don't, like, a lot of 15, 16-year-olds don't have long-term goals. So assessing that, like, lack of realistic long-term goals isn't really a fair assessment for young people. And as I mentioned, there's ethical considerations here as far as like being labeled, being highly resistant to treatment, it becoming a self-fulfilling prophecy. But folks are looking for this. Like if you are in the system as a minor and you're starting to display some of this behavior, and I have seen this in someone as young as 13, where she said all the right things. When you would process her behavior with her, you'd often walk away like really impressed because she had some good insight. And it took a while. It can take a long time, even with someone you're close to, for you to realize that the behavior is indicative of psychopathy, because they can be very charming and they know how to say the right things. They often know the right answers. They just don't feel them or experience them. So what might be playing a role in this? We don't know exactly, but some genetic factors like our temperament is partially genetic, right? Here are some features we have seen like from fMRIs and things like that, are that there is low arousal and low fear responses. That's the part of us that is responsive to punishment as well, right? We don't want to be punished. We're fearful of being punished, so we behave, right? Until we can internalize like that behavior morally and ethically. And so if you're not experiencing that, how's punishment going to work for you, right? Might be disrupting their ability to form a conscience. Could be brain abnormalities. Could be part of our central nervous system, right? The human body, the human brain are complex, and we still don't fully understand them and understand how they work. 50 years from now, you guys might have grandkids who go off to school. They're going to study the same thing. They're going to ask you, Nana, Papa, Gramps, whatever you want to be called. Did you guys really believe this nonsense about psychopaths back in your day? Right? Because maybe we'll have a better understanding. It would be great if we had a better understanding. So what are some differences between psychopaths and non-psychopaths in terms of our central nervous system? That's our brain and our spinal cord, right? In the cerebral cortex is where we interpret things. Our thoughts are there, our memories, images. It could be maybe there's some problems with like the two hemispheres of your brain. Like, is one of them deficient? Are they not? do they have asymmetry? So the right hemisphere is generally our nonverbal functions. It's understanding and communications of emotions, whereas the left hemisphere is more verbal language functions, our ability to look at things analytically and in a sequence. It's also where like the parts of us that inhibit our bad behavior are. Okay. So if there's not a proper balance between those two hemispheres, you'd be experiencing asymmetry, and that's an abnormal or unusual balance. So psychopaths are strikingly inconsistent between what they say and what they actually feel, what they actually do, and what their intentions are. So as I mentioned, I had this kid that I worked with, and she was 13, and for a long time I thought like, wow, she's whip smart and she's learning a lot from her behavior. And then there was a point at which it turned, and the rest of us were like, uh-oh, I think she's going to be a problem long term. And we were pushing therapeutically. She was not in the juvenile justice system yet, but we were trying to push her over there to start to create a paper trail for that, because she was starting to become problematic. So for instance, if you work with troubled kids, you will often be assaulted, but generally speaking, you don't press charges. They're in a therapeutic environment. You kind of know you signed up for that. Well, this kid kicked me, and I was the only person who didn't have hands on her at the time. She was being restrained. And so therapeutically, the decision was made by her therapist that I should press charges so that we could start to push her over into the juvenile justice system. And that takes a long time because nothing happened with those charges. By the time it went to court, I didn't work there anymore. The judge kind of felt like, oh, well, she doesn't pose a threat to you anymore. She never posed a threat to me. Other people had her arms when she kicked me. Like, she never actually posed a threat to me, but she kicked me. She kicked me in the hip. She kicked me in the hip. And then, she was in treatment. But that's why sometimes you make a therapeutic decision to try to press charges against someone, because it's going to take so long, especially someone who's already in a therapeutic program, to get them into that system. Okay. Now, the left hemisphere hypothesis says that psychopaths have deficiencies that require activation of the left hemisphere. They do recognize emotional cues abstractly, but they don't feel the connection to it. You know how sometimes you read something or you see something and you're like, that brought me to tears, right? Sometimes it's like a sappy commercial on TV. Sometimes it's a sad movie. Oh God, I don't know if you guys have watched We Were Liars. I think it's on Netflix or Prime. And I did not see the ending of that coming, and it's the first time in a while where like a movie made me like sob, where you like not just like tears run down your face, but you feel it in your chest, your throat starts to close up, right? So psychopaths know, oh, you're supposed to be acting sad here. They don't feel any of that piece. I mean, they don't always know cues either, but they can know them. They don't feel any of that. There's a book that came out in summer 2024, maybe. This woman, her name is Patrick, I think her last name's Gage. And she is a sociopath. She also has a PhD, I believe. She's married, she has kids. She'll tell you she loves them, but psychopaths aren't capable of experiencing that emotion. And she did seek out a diagnosis and seek out understanding her behavior. But if you listen to her talk, she's been on a bunch of podcasts. I was actually going to have a class read this book when I taught a class on psychopathy, but I found her so grating in her book, and it was so hard because of like the lack of sincerity that I was like, I can't ask people to read this book because I can't finish this book. But I do have a PDF of that book somewhere, so if it interests you, shoot me an email. I'll send you a link. Now, there might be some damage in our frontal lobe, right? So our frontal lobe, that's where the prefrontal cortex is. That's not fully developed till you're 25, but it's responsible for executive functioning, long-term planning, decision-making, higher ordered stuff, right? It's where our organizing behavior, memory, inhibition, planning strategies, right? And so damage here can result in poor decision-making, okay? And any damage that occurs before the age of 16 months, those people's brains look very similar to psychopaths, okay? Now, the amygdala and the hippocampus are responsible for processing our emotions. The amygdala is associated with fear, anger, and disgust. It's involved in learning and short-term memory, especially in situations with high emotions. Psychopaths have lower activity in their amygdala, right? So that makes sense, right? They don't really experience fear. They don't experience anxiety, right? Those are the things that generally keep our behavior in check. Those are the things that allow punishment to work on non-psychopaths. Now, there's also your peripheral nervous system, okay? So there's the somatic nervous system. That's motor nerves that stimulate muscles. They're involved in, like, how our body moves. And there's autonomic. That's the stuff that happens automatically, right? Like, your heart rate, you don't have to, like, right? Like, if I want to stand up, it happens kind of subconsciously, but I have to make that choice to stand up, right? You don't make a choice to make your heart beat or to breathe every day, right? Like, that just happens automatically. Things like your glands secreting stuff like that, right? So we see some differences here between psychopaths and non-psychopaths. So your sympathetic nervous system is that fight or flight, which is also really includes fawn and freeze, right? But it's like there's like, the part of your brain that thinks that, like, I don't know, it's hundreds of years ago and you're being chased by a saber-toothed tiger and therefore you better come up with a plan and you better haul butt out of here, right? But really you're just nervous about a test, or you're nervous for no reason whatsoever, right? Like, you think the saber-toothed tiger is chasing you, but he is not, okay? The parasympathetic system can spring into action more quickly in psychopaths. Okay, the way we measure this is we look at emotional arousal, and we measure that by someone's heart rate, their blood pressure, their respiration rate. Skin conductance, that's like whether or not, like, you're sweating. Like, so this is all the stuff, by the way, that a lie detector measures. A lie detector does not measure, a polygraph does not measure if you're lying. It's measuring your heart rate, your blood pressure, your skin conductance, and your respiration. So anything that would make those things go up will make, because generally when we lie, there's changes in those, like, our body changes, our heart rate, our blood pressure, etc., right? And so that's what a polygraph is measuring. If you're super nervous, you can fail a polygraph. If you don't feel guilt or fear and you're under aroused, you can pass a polygraph. This is why polygraphs are not used in court. Psychopaths appear to be under-aroused in that autonomic nervous system and in their prefrontal cortex, in their cortex as well, right? They appear to be deficient in avoidance learning, right? So we learn that certain things have unpleasant consequences and therefore we avoid those things. They don't really do that. That doesn't really happen for them. Now, what does the childhood of a psychopath look like? Okay. And this is a tricky thing to think about, right? So there are some genetic causes probably of psychopathy. We haven't narrowed them down, but we do know there's biological genetic things happening here, right? I hate the idea that psychopathy is genetic, because that means, like, some cute baby's being born somewhere, a family is oohing and ahhing over them, and that baby's going to grow up to be like a Ted Bundy. I really am uncomfortable with that idea, right? We do know, though, right, that we might have genetic predispositions for things, and then our environment can turn those genes on or off. And so that's probably what's happening here as well, right? So it's a complex interaction of biological, physiological, social, learning factors, right? And it can begin in childhood and continues through our adulthood. And you could see it's going to have a ton of overlap with other features that are parts of other diagnoses. So, like, if you look at this list and you're like, yeah, I'm kind of a big fat liar, that doesn't mean you're a psychopath, right? You have to be displaying a certain amount of these characteristics fairly regularly. Okay. Many people are impulsive and are not psychopaths. Many people have conduct issues and attention problems, right? And negative school experiences. It does not mean that they become psychopaths. Okay. I think we talked about life course persistent offenders before. These are folks whose offending is not just rooted in, like, adolescence, but they have difficult temperaments. They've been rejected by their peers. They don't have a lot of empathy or concern for others. They tend to become long-term offenders. And they have traits that are very similar to psychopaths. So how do we treat these guys? We can't. As of right now, we can't. Adult psychopaths are not responsive to treatment. Now, it's hard to evaluate them because they're skillful at being manipulative, right? And Hare wrote a book. I think I gave you guys one or two of the chapters for reading for this week, but I also have this. He wrote a book about, and it's a super easy read. It's not a very clinical read. And he tells you about some of his interviews with psychopaths and, you know, how manipulative they can be. And it can be hard to spot. As I mentioned, you know, I worked with that 13-year-old, and obviously she would not have a diagnosis of psychopathy. She was not in a prison. She would not have a diagnosis of antisocial personality disorder because she's a minor. She might have had conduct disorder. I can't recall, to be honest with you. But, oh my God, where was I going with that? Oh, it took a while to see this behavior, right? So what do we do? Children and adolescents. Children are more malleable, right? They're more resilient. We can do more to help them, both if they're displaying these traits or any other kind of antisocial problematic traits. We can do a lot more to help minors, adolescents, teens, children than we can to help adults. Adults kind of have to, I mean, everybody has to want to change, but this is much harder with adults. Kids can respond better to reward-driven interventions, right? And so we have seen some reduction in some psychopathic characteristics with kids with the right and intensive therapy. Now, it could be that those kids weren't going to develop into full-blown psychopaths, or it could be that we prevented that from happening.